Hello and welcome to another live broadcast with MedStar Health. My name is Mishan Carter, and I'm joined today by sports medicine orthopedic surgeon, Dr. David Cohen. Today, we're going to be talking about the ACL, the knee ligament that is often injured while playing sports. We're also going to talk about what causes ACL tears and if they can be prevented. Also, what are the sports that seem to be more frequently causing these injuries? Is there a difference between male and female athletes? What's the impact of these ACL tears on the kinetic chain and how ACL injuries, how can they be treated? So if you're interested, if you're an athlete, a parent of an athlete, who wants to safely continue playing, then stick around, share this broadcast with your friends, share your questions with us in the comments below, and keep watching. All right, so thank you, Dr. Cohen, for joining us. Before we get started into our questions, thank you and welcome. Before we begin, could you tell our viewers a little bit about yourself and the work you do at MedStar Health and your specialty, especially with sports medicine?
Sure. Thank you, Michonne. Yeah, I'm Dr. David Cohen. I'm an orthopedic surgeon specializing in sports medicine. I've been in practice for almost 17 years and did my training here in Baltimore, but did a sports medicine fellowship down in Miami with UHC Sports Medicine. In the community here, I take care of a lot of high school and college athletes, and I'm one of the assistant team physicians for the Baltimore Orioles here in town. See and take care of a lot of ACL injuries.
Awesome, and thank you for your work, and thanks for all that you do for our patients. So we're talking about ACL injuries. Could you briefly explain the anatomy of an ACL? What does that stand for too?
Sure. So the knee basically has three bony components, which are the femur bone, the tibia bone, and the kneecap. And you have your muscles that surround it, but then you also have ligaments that help stabilize it. And this is a little depiction here of the femur bone and the tibia, the kneecap here. You have ligaments on the sides, which are called your collateral ligaments that keep the knee from going side to side. You have your medial collateral ligament, or MCL, and your lateral collateral ligament, or LCL. You also have two ligaments in the middle that cross, and we call those the cruciate ligaments. The one in the front is the anterior cruciate ligament, and the one in the back is the posterior cruciate. And you can see the color designation here for the ACL. And so that's what we're talking about when we talk about an ACL injury.
Thanks for explaining, and thanks for the illustration. I think it helps people visualize. It helps me too.
Yeah,
So thank
yeah,
you.
absolutely.
So how does an athlete know if they've torn their ACL? What are the symptoms? What should they be looking out for?
Sure. So, a lot of times on ESPN and, sports shows, they show these dramatic injuries where athletes are getting clobbered by someone. And certainly that is a case where you can injure your knee or your ACL. But sometimes you can also injure it in what we call a non-contact injury, where you just stop suddenly and your body motion just creates enough force for the ACL to tear. And the usual symptoms are, and most folks recall feeling or hearing a pop within their knee. This is typically followed by swelling and stiffness and pain.
Okay. So let's say, the worst has happened. You hear that pop, you tear your ACL. What do you do next? Where do you go? Do you go to the ER, urgent care, primary care? When should you see a specialist? How's that process?
Sure. So typically, these things swell up pretty fast. And if you're a collegiate or a high school athlete or professional athlete, a lot of times an athletic trainer is going to be there, and they can kind of make an early assessment to see what's going on. And in those cases, they may be able to say, you know what, I think you injured your ACL. You could probably try and get in to see an orthopedic surgeon in the next day or so. If you're not in that environment and you're just playing some recreational sports, or you just stumble and trip, probably your best option is to go to an urgent care center. We have lots of prompt cares around the region that have some folks who are trained in these sort of evaluations and can make that decision. Sometimes the waits in the ERs are a little bit long, but typically we like to have those folks referred to us within about 24 to 48 hours so that we can make an assessment and figure out what the next steps are. Oftentimes you can make the diagnosis of an ACL tear just with a physical examination. There are certain maneuvers that we can do, and one test in particular called a Lockman can tell us if there's increased motion or laxity within the knee. When we have the high suspicion, we usually send folks for an MRI, which is a test that looks at the knee in 3 dimensions and can give us a little bit more clarification on the injury.
All right, that you went right into my next question about the diagnosis. So thank you for explaining that.
Sure.
Is it possible to also sprain the ACL, not fully tear it, but sprain it? And how do you categorize those injuries?
Sure. So, most things in orthopedics are categorized as good, bad, and ugly. And, certainly a good injury is a sprain. Sometimes these can occur just with, a minor injury where you have what we call edema or swelling within the ligament, but no disruption of the fibers. The ACL has 2 bundles that kind of wrap around each other, almost like a braid. And it is possible just to tear one of the bundles where one is still intact, which we would consider a grade 2 sprain, or kind of a bad but not ugly. And ugly would be when you completely tear the ligament. And in most cases, those need to be either repaired or reconstructed.
All right. And what types of movements can cause a sprain and what can cause an ACL tear?
Well, most of them are very similar. The ACL works by limiting the anterior translation of the tibia. And what that means is it keeps the knee from moving forward. And so these type of injuries happen if you stop short. So if you're running on a grass or turf field and you stop suddenly, your body motion can continue and it can cause the ligament to be strained and eventually tear. Of course, you can also have direct trauma where someone hits you from the side of the leg, or you come down on it at a certain angle with the leg extended, and that can certainly cause a similar type injury as well.
All right. That leads me to my next question. Can ACL tears or injuries be prevented? Is there, a certain routine, a strength exercise or stretches, any sports performance programs that people should be aware of that could help?
Yeah, so the things that have been shown to prevent ACL injuries are neuromuscular training. A lot of times just how your legs function and move can be preventative. Keeping your legs strong, making sure that if you jump, you land in a certain way where it's not putting increased strain on your knees. And some of these techniques can be taught by an athletic trainer or a physical therapist. And there are programs available, if you were to search them out.
All right. And another question, do male or female athletes have ACL injuries more often? And are there any anatomical differences that could lead to that?
Yeah, so that's a good question. There is a little bit of a more of a tendency towards ACL injuries in women, although if you look at the whole number of injuries, they are slightly comparable, as I think males are more involved with sports, but that's changing over time. There is some physiologic differences between men and women. Women tend to have a little bit more of what we call valgus alignment, which is a little more knock-kneed, which puts a little more strain, within the joints. They also, in the opening where the ACL sits, typically looks like a U, but in some females, it's more of like an inverted V, and that has been theorized to put increased strain or stress on the ACL. Another thing that's been shown to be somewhat of a factor is estrogen levels, and those can change throughout the month with women as they go through their cycle. And, estrogen's good when you're having a baby because it makes things stretchy and lax, but, sometimes that's not so good if you're preventing an injury.
Absolutely. I can relate. I had my baby a few months back and had a hip injury and found out, yeah, there are things moving around because your body's going through changes. So it's
Exactly.
especially aware, important to be aware of those things. And I definitely did not know about that.
Yeah.
Yeah. So thank you very much, Dr. Cohen. I want to pause and welcome our viewers again. If you're just joining us, thanks for tuning in. We're joined by sports medicine orthopedic surgeon, Dr. David Cohen. We're talking all about the ACL tears and injuries, even sprains, and how to prevent them, how to treat them, how they're diagnosed. So if you'd like to learn more, stick around and share this broadcast with your friends. Give us a like to let us know that you're watching. And if you have any questions, please share those in the comment section below. We're going to take some time to answer those as well. All right, so I have a few more questions of my own. So Dr. Cohen, we talked about the effect that sports can have in the likelihood of you having an ACL, tear or sprain. Which sports in particular are more likely to have a higher risk of causing tears?
Sure. Certainly, the more collision sports are going to be the ones that we think about with a higher incidence. So football, certainly when you're colliding at another person at full speed, puts you at risk. Other sports that involve a lot of jumping, cutting, pivoting, and twisting, such as lacrosse, soccer, and basketball, are other sports where you're at a high risk for injury. But certainly it can happen with almost anything. Sometimes it's seasonal. We do see an uptick in ACL injuries during ski season, and then certainly when all the various sports are going on.
All right. And what about field athletes? Does playing on turf versus grass have an impact?
That's a debate that kind of goes back and forth.
Mhm.
Originally, the original turf was AstroTurf, which was essentially carpet. And so it created a lot of friction. And so when people would stop suddenly, their momentum would carry them forward, and there was a little bit higher incidence, of injury. It's gone kind of back and forth. Now most of the artificial turf fields are kind of fake grass, and they have, rubber pellets that try to give it more elasticity, so it's similar to grass. But I think that the incidence of injury is still going to be high regardless of the type of surface that you're on, given the sports that you're playing.
Okay. And leading into treatment, what does that process look like? Is there such a thing as like a conservative approach or, anything that would require surgery? At what point should the patient be prepared for that outcome?
Sure. So, typically after you've initially been evaluated, you've had your examination, you have an MRI, the next step is to kind of go over your options. And, surgery isn't for everyone, which is, kind of the first thing that we say. Certainly there are what we call copers, people that can live without an ACL. And, the one misconception that a lot of folks have is that if you're ACL deficient, your leg's going to fall off and you can't do anything, which isn't true. You could walk straight, all day long. That times when the ACL tends to be an issue is if you're changing direction quickly. And that's going to give you the sensation that the knee wants to buckle or give out. But there are certainly individuals, and you may be older and not really playing a lot of sports and want to just keep a low-key lifestyle, who can work on some therapy and strengthen their leg and are able to accommodate pretty well. The folks who are athletic and participating in sports and want to get back to those sort of activities are the ones that we typically will recommend surgery. And surgery typically involves a procedure that is done arthroscopically. More recently, there's been some studies talking about doing direct repair of the ACL. And there's several investigational programs that are ongoing looking at that. One is called the BEAR study. And then there's actually a direct repair, which some of the folks within our system, such as Dr. Wimi Dewogi down in Washington, is doing. But traditionally, the surgery is a reconstruction where we remove the old torn ACL tissue and create a new ligament. And there's several options and ways of doing this. The most traditional way is using a portion of the patellar tendon, but there have been shown equal results with using your hamstring tendon or a portion of your quadriceps tendon as well. And that's a discussion that you can have with your orthopedic surgeon to see, what the best option for you is. And it varies from person to person.
So if you have suffered that ACL tear and it, the doctors determined that it's best for you to have surgery and you go through with it, how long is the recovery process? And what would that involve? I imagine, physical therapy, some follow-ups.
Yep. So, I always like to tell folks it all starts in phases. And, the first step.
All right, we had a few connection issues, but we're joining again with Dr. Cohen talking about ACL tears. And where we left off, we were talking about the recovery process. So if, your doctor has determined that you need surgery, how long is that process and what does it entail?
Sure. So, I usually start by telling patients that, this is a partnership. And we each do our part. My part as the surgeon is to fix your knee and make sure that it's stable and can allow you to get back to what you need to do. But your part as a patient is to follow through with the therapy and doing all the instructions that we require afterwards. Typically, it starts with the surgery itself. And so, after surgery, when you wake up, you're usually in a brace. Typically, we see you back within 7 to 10 days to evaluate the knee, get your sutures out, and oftentimes therapy is started within that period of time. And therapy is a key component because it allows you to get back to using that knee functionally. And it goes in phases. The first phase is typically to get that knee moving and also to work on some strengthening. Usually by around 6 weeks, most folks are out of their brace and able to do day-to-day life functions without a lot of difficulty. By around 3 months, if things are going well, we get you started in a running program and a lot of times with what we call plyometrics. And typically after that, we're really trying to get you back to what we call return to play. And that can be as early sometimes as 6 months. On average, it's probably closer to 9 months and sometimes up to a year, depending on how people are doing. And the goal is to get you to the point where you're functional and can get back to playing or participating in whatever activity you enjoy, and making sure you don't re-injure yourself or cause, another setback or injury.
All right. And most importantly, for athletes, what do you consider when determining when someone is ready to get back on the field and play their sport again?
Sure. And, that's always a tough thing because a lot of folks can say, I feel great. My knee is back to normal. But we have different functional tests that we can do. We measure your thigh circumference to make sure that your muscles are equal on both sides. There's some testing that the physical therapists do to see if you have enough strength and stability. And one is just a simple hop test that, you go side to side and front to back. But then they also have some more dynamic testing. And there have been a lot of strides made within the physical therapy literature looking at different performance testing to make sure that people are safe. And that's the whole goal, is that the last thing you want to do after spending nearly a year in recovery is to re-injure yourself. And we want to make sure you're ready to go.
Absolutely. And just thinking long term, what does that look like for surgical patients? Do they need to make any lifestyle changes? Or, can they still return to their sport, maybe not as much or at as high an intensity as before? What does that look like and how is that determined?
Sure. And that's a great question. Certainly we would love to say that 100% of people get back to playing their sport and activity and it's like nothing ever happened. But that's not reality. You know, realistically, about 2/3 of folks get back to, pretty high level of what they were doing before, but there is that subset of people who do not. And it's something to be aware of. And there are a lot of factors that come into play. Some of it can be psychological. There's that fear of re-injuring yourself. Sometimes, people do have various missteps in their recovery and, just don't get back to the same level that they were before. Um, Down the road, long term, we know that there is a higher incidence of arthritis, with an ACL type injury, with or without surgery. Typically, that's not immediate, but sometimes 20 years down the road, that's something that can happen and something to be aware of. So even though we've made huge strides in helping people and in making sure that folks can get back to the level of activity that they want and desire, there's still those things that we need to remember.
All right. Now, why should patients and athletes choose MedStar Health for sports medicine care? What sets us apart?
Sure. So, the one thing that's unique about MedStar is we have a large system that extends, through Maryland and Baltimore and into Washington, D.C. And we have probably the largest network of sports medicine providers. And some of them are non-surgical. We have, sports medicine providers who can still see you, evaluate you, work you up, get the MRI, and make those clinical decisions, but then hand you off to a surgeon that, like myself, that does these surgeries, and we all work as a team. We tend to cover most of the areas within the region. We cover a lot of the youth sports, a lot of the high schools and colleges, and even most of the professional athletes, within the region as well, which gives us a large amount of resources and expertise in the area. Another thing is, because we're such a large system, we have an extensive physical therapy group, which is just as important in your recovery. And over the years, it's really become integrated so that all the protocols and the ways that we treat people, pre and post operatively, are readily available to all the folks within the system.
I like the sound of that. It's good to have all the people well connected that you need to see in your health journey and your recovery journey. So it's good to know. So lastly, Dr. Cohen, what do you most want people to take away from this conversation, and what do you want people to know the most about ACL injuries and the recovery process?
Sure. I think, knowledge is key. Understanding, what the mechanism of injury is and how to figure out, did you tear your ACL? And then just understanding that, there is a process and ways to treat it to hopefully eliminate some fear. I think that, certainly that's something that, most people get really concerned about is, whether or not they tore their ACL. And I would say, at least on a weekly basis, I see someone who's almost panicked, and sometimes just understanding that you may have injured it, but you may not have. And there are other things that can happen. But to know that, if you have that fear and suspicion, to get it evaluated and have a conversation with one of our sports medicine doctors.
Well, thank you very much. Well said. And thank you very much to all of our viewers for tuning in and giving us a like, letting us know how you feel about this broadcast. We hope that you've gotten some really important takeaways from this. To learn more or make an appointment and schedule an evaluation with Dr. Cohen, you can call us at 877-34-ORTHO. That's 877-346-7846. We're going to put that phone number and other information from our website so you can take a look when you have a chance. All right. So thank you again, Dr. Cohen, for your time. Thanks for joining us today, and we will see you next time.
All right. Thank you, Michelle.
You're
Take care.
welcome. Okay. Bye-bye.